as far as you are concerned, you know yourself better. So when you see some of those things, it's important that you get to the hospital as quick as possible.
So let's look at, with all what you just mentioned earlier about the signs, the early signs and the symptoms, is that you are like you be feeling or expecting, or they are coming for that particular moment. So let's look at for a woman. So did you think if you have all those signs will change the size of your breast? Is your breast going to big or small or like just medium? What are some of the, let's look at that kind of area.
So, like I said, when it comes to your structural being,
okay,
like every individual knows how they are,
okay,
as far as their structure is concerned. Now, to be specific to the breast, I mean, on a daily basis, when you wake up, you look at yourself, if you have a mirror, and you feel yourself sometimes. This is very important. It's not weird to touch your breast, just to make sure you know how it is. In an event that there is a changes, you will be able to pick whether you are having hard breast or whether you feel that your breast is changing in terms of whether it's big or is getting smaller or is getting wrinkled, or you have start seeing certain things that you think are actually abnormal. Now, when you see these things, it is obvious that something is not right.
Okay.
Now, we might not say that, yes, you have cancer now.
Okay, okay.
But like you said earlier, what is more significant as far as the whole sensitization is concerned is called early detection.
Detection, yeah.
This helps a lot in managing if there is cancer.
Okay.
So, in a nutshell, what I will say is, when you look at yourself, you should be able to determine whether there has been any changes in terms of shape, the size, whether it's big or small, whether it is hard, whether you're feeling lumps or particles around it, whether it's painful. You might feel some sort of changes that you think is not normal on a regular day, how you feel yourself.
So are men also suffering from breast cancer?
Yes, it's not common,
but
it happens. Okay, so but the most, when you look at the prevalence, it is more common in women than men, but that does not mean that men cannot have it. Like I said earlier, when you look at cancer, it is an abnormal cell growth that can occur at any part of the body. Which is why when you look at cancer, they are given different names. Skin cancer, breast cancer, cervical cancer, colonal cancer, rectal cancer, different, depending on anatomically, that is structurally, depending on which part of the body is affected. Okay, of course, there are certain things that are more in women than men, like the cervix. Men don't have cervix. Obviously.
Yeah, that's true.
So cervical cancer will obviously happen in women than men. But of course, men have breasts. So obviously, there is a chances that they will have it. It is not common, but it happens.
Okay, so how important is early detection?
So early detection is by far one of the most important part as far as the management and prevention of cancer is concerned. Because what will happen is, if the cancer is detected early, it helps the team, the multidisciplinary team, to know what to do. That includes either to do what is called a surgical intervention, or they will do adjuvant therapy, or they will do what is called chemotherapy and all that. Why this is because it will help to minimize the spread of the cancer to other surrounding tissues, because you might develop what is called metastasis. That means the cancer might metastatize. That is, it might move from the place of origin to other places or surrounding tissues. So if the cancer is detected early, it is very important in treatment and management. Thereby, it avoids the spread of the cancer cells to other tissues. So that is a very, very important part.
For the early detection. So, let's look at for the interior. There are so many people out there. Some don't have, it's not like they don't have the opportunity, but like they don't have the kind of know or knowledge about breast cancer. And when you do a case study, you will see that at the villages, you will see that a lot of women are dying from this kind of disease. So as a medical personnel, what are you guys doing when it comes to those people living in those interior places?
So This is a very important topic, and the question that you asked is very, very relevant. Now, what is important is we need to have what is called decentralization of detection of this particular case, that is breast cancer. Not only breast cancer precisely, but the fact that we have been specific to it. What we can do is to continuously sensitize the general public, thereby reaching people that are in provincial areas or up countries, creating opportunities for them to be involved in screening routinely, because like we said, early detection is very essential. So the best way that we can have a target group is to go into the provinces or the interior, organize medical camps, invite people to come in, give health education, tell them the relevance of breast cancer and why it is important for them to come and be screened as early as possible, and also give them what are some of the presenting signs and symptoms. Now, if they don't have the opportunity to be screened at their level, some of them will have the opportunity to travel down in the urban centers to get themselves scanned or tested. So I think the best way we can deliver to them, the best way is to go into the interior level or the rural area, organize medical camps, talk to the community, sensitize them, tell them what is breast cancer, what are the signs and symptoms, provide free screening session for people, and then encourage them to be mindful of these signs and symptoms and report to nearest facilities as quick as possible.
So what are the type of screening did you recommend as a medical personnel?
Well, when it comes to the diagnosis of breast cancer, it is divided into 3 parts. Now, you have what is called mammogram. That is a spatial scanning that is done in order to detect any abnormalities within the breast. And this investigation is the most common and frequent used investigation that is widely available and cheap and probably less painful. Okay. You also have what is called needle biopsy. This is a spatial procedure wherein they take certain samples from your breast tissue and they take it to the lab for what is called histopathology. So you also have spatial screening. There are spatial investigations that include blood samplings. Now, there are specific agents that they are looking inside your blood that might be suggestive of cancer, because when you have cancer in your blood, there are certain valuables that you might see. So medical personnel will do what is called scanning, which includes the mammogram. They will do sampling or sample collections. That might specifically be blood and all that. They might also do what is called a biopsy. That is, they might take a specific tissue. And so, but for the records, the most recommended one, which is readily available and easily affordable and that people can benefit from in most cases, even routinely that we use, is called the mammogram. So this is a spatial scanning that is used on the breast in order to identify lumps and other abnormalities.
So what are some of the risk factors of breast cancer?
So that also is a very, very important question. When you look at the risk factors, they have been divided into different things. Age is one of them.
Age,
it is believed that people that are of at least 35 years and above are at risk of developing breast cancer. But significantly, this condition has been found even in younger people. But age is a risk factor. Obesity, that is, we believe that people that are obese are also at risk. We also have what is called alcoholism. This is also a risk factor. People that are not eating healthy, we believe that you need to eat very healthy meals in order to avoid these unnecessary cell growths. So unhealthy diet is a risk factor. Age is a risk factor. Sex is more common in women than men. So the risk factors are basically about women, age, unhealthy diet, alcoholism,
and sex.
Not really.
You mentioned all about sex.
when I say sex, I mean as in the gender.
Oh, the gender. Okay,
yes,
that's fine.
Like male or female.
Or female. Okay,
yes,
that's fine.
Yes.
So, what are some of the ways that to put in place to reduce all those risk factors?
So, first of all, people need to do what is called, they need to do healthy diet. They need to eat healthy, they need to do exercises, they need to do away with bad lifestyle, or we have to do what is called lifestyle modification. And if you are a woman, it is very essential to routinely, at least every 3 years, except proven otherwise, but at least every 3 years, go to the hospital, check yourself.
Every 3 years?
2 to 3 years.
Okay.
Let me just say 3 years. Every 3 years, you get to the hospital.
One time?
Yeah, once. Just scan your breasts. Talk to the doctors. Just make sure everything is okay. You don't have to wait until there is a problem, and you start handling it. It's very essential to do medical checkup routinely. Now, in the case of breast cancer, you can do every 3 years. Except if you feel abnormal. That is, if you start feeling that everything is not normal with you, then you don't need to wait for 3 years to go and do the screening. So the best way to prevent this is to go to the hospital, eat healthy, exercise, and modify your lifestyle.
Okay. Yes. So could you tell us the different types of breast cancer?
Now, breast cancer, it depends on, it has what is called staging, and it also has types. We have metastatic breast cancer. That means it has moved from its place of origin to another. You have what is called nodular breast cancer. That is also another type of breast cancer which is confined. You also have what is called molecular or tubular breast cancer. So there are different type of breast cancer that can affect women. Now, they might also have what is called stages. Stages, depending on how severe the cancer is. You might have stage 1, stage 2, depend on how aggressively the cancer cells have migrated from their place of origin. The clinicians or the specialists will be able to determine, to say, okay, this is stage 1, this is stage 2, this is stage 3, as far as cancer is concerned, or breast cancer is concerned.
So what are some of the treatments across all those stages you just mentioned? So
first of all, we have what is called surgical intervention, depending on the stages. Like we said, early detection is very essential. So if the cancer is detected at a very early stage, the specialist might intervene surgically. That is, they might remove that part that is cancerous so that it will not spread to the surrounding areas. So that is one of the treatment modalities that might come in. You have what is called surgical intervention or surgery. The second one is chemotherapies. These are, or radiotherapies. These are special treatment modalities that are given to people with cancer, breast cancer. The plan is to reduce the spread of the cancer cells, or to minimize how aggressively the cancer cells will be spread into the surrounding areas. Of course, they come with some complications and risks, but they look at the benefits when it outweighs the risks, so you go into it. You also have specific treatment plan wherein they use special hormones, and what they do is they help to facilitate the process of reducing the spread of cancer cells within our system. So those are the 3 mechanisms that are put in place. You have surgical intervention, you also have what is called radio or chemotherapy, you have the hormonal therapy that are used in order to prevent the spread of the cancer.
So let's look at another area, because we have been seeing, maybe let's say on social media, that's a lot, like 5 or 10% of other women have been through operation. How long time you think that woman could live after the operation?
Well, like I said, when it comes to breast cancer, what we need to understand is to what extent is your cancer. Now, yes, it is unfortunate that in developing countries, it is very difficult to manage and treat, the cost also, and also there is what we call denial. Now, people need to first of all accept their problem for them to be able to help.
Okay.
Now, and also psychologically, how do you relate? How do you take this condition? We need to understand one thing. When you have breast cancer until you undergo surgery, or when you have breast cancer in general, people need to understand that this is not the end of your life. You can still go out, you can still go to the beach, you can still go to the restaurant, you can still hang out with people. So when you say how long you will live, it depends on so many factors. It depends on the stage of the cancer, how bad it is, has it metastasized or has it moved from the place of origin to other surrounding areas, has it affected other organs and tissues. So that will determine how long you will live, and also what is the nature of treatment you are receiving as far as your cancer is concerned. Are you receiving what is necessary? Are you having what it takes to receive the treatment? So it's a bit complex to say, okay, you might live for 3 years, you might live for 5 years, you might live for 10 years. In developing countries, it is very difficult when you have cancer, because what happens in most cases, they are detected when they are already out of line, in most cases, because people don't get themselves tested, people don't get themselves screened. So by the time you come to the hospital for us to confirm that you have cancer, it has already moved from where it is originated to the surrounding tissues. It might already involve your lungs, your kidneys, your liver. Then it becomes very difficult to control now. So you might go through chemotherapy. Now, look in Gambia, for example, it is very difficult to have the treatment here. Some people have to go to Dakar, and it's very expensive. So if you are not fortunate, you will not be able to foot the bills. So those are all factors that can affect your lifespan.
Okay. So what are some of the challenges that women in the Gambia face when it comes to awareness, breast cancer awareness and the treatment?
So first of all, that is what they call body shaming. Okay.
Here.
Yes. When people have breast cancer, sometimes they will be neglected. People will run away from them. People will think that this is the end of their life, and societal concept is very bad. And societal influence affects women with breast cancer. But the other thing also is that is your structure as a woman. You know, you wake up one day and realize that, for example, they have to remove one of your breasts, okay, because it's cancerous. Or you have to wake up one day and realize that my breast is cancerous. That self-worthlessness is there, and that affects women a lot. So structural affection, societal influence, that self-worthlessness, those are some of the things that affect women. And psychologically, it affects their way of living, it affects how they relate with the society, it affects how they relate with their own personal self and their activities of daily living. So these are some of the things that affect women as far as breast cancer is concerned.
In the Gambia. So let's look at as a medical personnel, what are some of the things you guys, because when it comes to breast cancer, I know you have a lot to do, especially like the challenges women are facing in the Gambia. What are some of the things you guys have put in place to minimize all those body shaming? So
first of all, we have what is called community sensitization. So now is a social media time. So most of the time we come on social media, talk to the community and explain to them what are some of these things and how can we tackle it. Now, if women also have breast cancer, we are now inculcating what is called occupational therapy, social therapy, emotional therapy, a lot of activities, a multidisciplinary set of team that comes together to look into things from different angles, from different pictures. Because remember, somebody who has breast cancer might be somebody who is actively working. This is somebody who has a family. This is somebody who wants to go out and enjoy themselves. So it is important for them to understand that it is not the end of life. So what we are doing is we come out to sensitize them, to help educate them, to give them relevant information as far as breast cancer is concerned, for them also to understand that they are part of the society, they can still fit within the community, they can go on their daily activities, they can go on their work schedules, and if they have what is called disabilities as a result of the breast of the cancer, there is another set of team that comes in order to facilitate that aspect, in order for them also to be inculcated back to the system.
So as someone who has experience when it comes to the field, what are some of the things you guys have put in place, especially for the conversation between the person that is going through this breast cancer? What are some of the quality conversation you have put in place, or steps to reduce all those kind of, like, when you talk about trauma, all those other things that the individual is going through?
So we have what is called patient healthcare relationship.
Okay.
Now, first of all, what we do is we try to build what is called trust and confidence between us and the patient. Okay. Now, this by far helps for us to relate with the patient. Okay. It also helps us to deliver that information that is necessary for the patient, because if the patient is able to trust you and believe in what you said, that is when they are able to accept their problem. That is when they are able to accept the guidelines that you're giving them. So what we do is we first of all create an environment that builds trust and confidence between us and the patient. Therein, we give them education in terms of how they can care for themselves, how they can integrate themselves to the society, how they can start life all over again, how they can realize that there is still another opportunity after breast cancer and they can live a decent life after that.
Okay, lastly, before you go, which advice did you want to send out there to someone who is going to taking the treatment of breast cancer?
So first of all, I will tell the particular individual to accept that they have breast cancer.
Okay. And
from there, they should understand that this is not the end of their life. Okay? This is a cycle that they are going through, and eventually they will get used to it, and they will have a decent life with time. Okay. They will wake up one day and dress very beautifully and go to work. They will wake up one day and go to the beach with friends and family. Okay. They will wake up one day and go to the restaurant with their husbands and partners to enjoy the delicious meals. Okay. So they just need to understand that they don't have to put this whole event on their head to an extent that it will reduce their self-worth. Okay. Okay? And again, it will affect their emotional being, and it will affect how they relate with people. It will inculcate nothing but emotions, angers, regrets into them. So they should not allow their current condition or situation to make them feel like they are not going to make it in life. They should trust in the process and believe that there is light at the end of the road. Okay.
I want to say thank you, Ms. Manneh, for honoring our invitation today and for sharing your insights with us. So to those that comment, I want to say thank you. To those that share, I want to say thank you. I am your host, Michael Afetrai. Till we meet again for another exclusive interview, signing out.
Thank you very much.